Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How long does an Ocrevus infusion take? The first 2 times you have Ocrevus, the infusion will take at least 2.5 hours. If you develop a reaction to Ocrevus during your infusion, the infusion rate will be slowed down and the infusion will take longer. Your whole infusion appointment will take around 5 to 6 hours, because there is a pre-infusion checkup, during which you will receive medications that reduce infusion reactions, and you will need to wait for at least an hour post-infusion so your healthcare team can monitor you for any side effects or infusion reactions. The third and subsequent infusions may be infused over 2 hours for those people who did not experience any serious infusion reactions, IRs, with the first 2 doses. If you have experienced a serious reaction previously, Ocrevus will be infused over at least 3.5 hours, depending on how you tolerate it. Ocrevus, ocrelizumab, is a treatment for multiple sclerosis, MS, that works by targeting a specific protein, called CD20 that exists on the surface of immature and mature B lymphocytes. Ocrevus is given by intravenous infusion, slowly, directly into a vein, once every 6 months, twice a year. The first dose of Ocrevus will be split into 2 infusions. On your first day of treatment, you will receive 300 mg of Ocrevus diluted into an infusion bag containing 0.9% sodium chloride and given directly into a vein over at least 2.5 hours. This is followed 2 weeks later by a second 300 mg infusion, again given over at least 2.5 hours. 6 months later, you will receive your next dose. This will be given as a single 600 mg infusion which will be infused over at least 2 hours provided you haven't experienced any serious infusion reactions in the past. Why does my Ocrevus infusion appointment take so long? Before each infusion, you will have a pre-infusion checkup. This allows your healthcare team to check for any signs of active infection. Check your vital signs, which includes your heart rate, blood pressure, temperature, and respiratory rate. Administer medications to reduce your risk of an infusion reaction, which will include a corticosteroid 30 minutes before the infusion, an antihistamine 30 to 60 minutes before the infusion, and possibly a fever-reducing medication. This will take around 30 to 60 minutes. After your pre-infusion checkup, it will time for your infusion. You will be seated in a comfortable chair along with your reading materials, snacks, and music. An 4-infusion needle will be placed in your arm and connected to an infusion pump. The infusion will last at least 2.5 hours but may last longer if you develop an infusion reaction and your healthcare team needs to slow or stop your infusion. After your infusion has finished, you will need to stay at the infusion center for at least an hour so that your healthcare team can monitor you for any side effects or post-infusion reactions. You are at risk of infusion reactions for up to 24 hours following your infusion. Contact your healthcare provider if you develop any signs or symptoms of an infusion reaction which may include a rash, hives, or itchy skin, coughing, wheezing, or difficulty breathing, dizziness, tiredness, or feeling faint, a fast heartbeat, fever or flushing, headache, nausea, throat swelling, tightness, irritation, or pain. An infusion reaction is most likely to occur during your first dose of Ocrevus. Your complete Ocrevus infusion appointment will take 5 to 6 hours. Related questions: what are monoclonal antibodies? Is Kesimpta better than Ocrevus? How much does an Ocrevus infusion cost? RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.